Another question. Someone asked, they had a sebaceous cyst for 7 to 8 years.
Right.
Can homeopathy help in this case?
Right, definitely. I have seen the cases where Sabacious Cyst is there for 30 years. Every month, every 2 months, he is going to get the abscess. There will be pain, there will be redness, there will be swelling. So even such cases can be completely cured with homeopathy. If you take one of the diseases where there is very good effect on Sabacious cyst or Sabacious abscess, homeopathy is the best treatment for them.
Yes.
For example, but the patients need to understand one important difference here. What is Sabacious cyst and what is Sabacious abscess? There is a difference between the success rate of Sabacious cyst and Sabacious abscess. For example, what is Sabacious cyst? On the skin, we will have different types of glands, right?
Yes, sir.
In one of it is Sebaceous gland. If the Sebaceous gland is blocked and the sebum is secreted inside, that is known as Sebaceous cyst. Cyst is not yet infected. There is only swelling, but there is no pain, no redness, no tenderness, no heat when you touch. That is Sebaceous cyst. Once it gets infected, there will be redness, there will be pain, there will be swelling, and there will be heat when you touch it, and there will be plenty of pus. When it is Sebaceous cyst, the success rate with homeopathy is only 50%. If I get 100 patients, I can cure only for the 50% of the patients. But if the Sebaceous cyst get infected and the patient is having severe pain, okay, some patients complain me that they cannot touch the wall even. They cannot lay down on the back when they have Sebaceous cyst on their back. So in that cases, homeopathy is going to be cured for more than 99% of the cases. When there is Sebaceous abscess, till now even one single case has not failed with me. So out of 100, almost 99.99% success rate will be there when there is Sebaceous abscess. Maybe it is a small abscess or a big abscess, 5 centimeters, even 15 centimeters Sebaceous abscess I have treated successfully, and the success rate is more than 99.99% when there is Sebaceous abscess. And the outcome is of 3 types. Out of 100 patients, right, 80% of the patients are going to be cured completely, and Sebaceous cyst is not going to occur in future or any other part of the body anytime. Both cure and prevention is possible in 80% of the patients. But in 20% of the patients, what happens is the disease will be completely cured, but it may occur in future. There are some patients who come to me after 20 years and say that, sir, I had Sebaceous cyst 20 years ago, Sebaceous abscess 20 years ago. I have taken the treatment from you. Till now there is no Sebaceous cyst. After 20 years, I have got it again. So we have inquired about you and we came for you again after 20 years. So it happens only in 20% of the cases, but 80% of the cases completely cured and completely prevented. But unfortunately, there will be 1% of the patients. In those patients, what happens is the Sebaceous abscess will get settled once they use the medicines. They have to use the medicines for a long time. Once they stop the medicine, it will come again. It happens only in 1% of the cases. Out of 100, one case will behave like that. Whether it is 6 months treatment or 1 year treatment or maybe 2 to 3 years treatment, homeopathy will not have even single side effect. So yes, that's the beauty of homeopathy. You are not going to use painkillers, you are not going to use steroids, you are not going to use antibiotics. Homeopathy tries to stimulate your immune system so that your immune system will remove the abscess from your body. That is going to happen, and even if you take for 2 years, in rare cases, 1 out of 100, you will not have even single side effect.
So even long lasting cases can get better relief.
Right, yeah.
Okay, sir. Thank you.
Yeah.